Rohit.
हाँ स्क्रीन लैपटॉप
Introduction to medicine hospital.
So how many of you are attending for the first time here? So many. So last time I had given just a bird's view of Viddha and Agni Karma, like as in how it has its branches in all Ashtangas. So today we are only focusing on Jatru Urdhva Roga only. But the thing is, before jumping into that, we need some introduction. So I'll be brushing up. For newcomers, it will be a new topic as an introduction to Viddha Karma. And for the people who have attended, it will be just a revision. Please don't think it has a boring start, because what I feel is when your basics are clear, you will be confident to do Viddha Karma. So even when sir takes a lecture, in every slide he starts with what I start. I have copied him. That's all. ಕೀಬೋರ್ಡ್ ಇದೆಲ್ಲ ಈ ಕೀಬೋರ್ಡ್ ವರ್ಕ್ ಆಗ್ತಿದೆ. So the thing is, where, according to my experience or what I have seen when I was learning with the Karma and Agni Karma, what I feel is where modern science fails, there Ayurveda starts. Because I have seen cases which are very difficult to treat, where modern science have told you should live with this disease lifetime, has been treated through Ayurveda, through Viddha Karma, through Agni Karma, along with other treatment protocols also. I'm not telling whole and soul through Viddha Karma and Agni Karma. Viddha Karma and Agni Karma is just like a catalyst. In a chemical laboratory, we use catalyst to speeden up the reaction, right? So similarly, these are two treatments which are boon to Ayurvedic fraternity. So that's why we need. So I'll share. So today, as the topic is Jatrurtva Gata Roga, so I'll start with one story, a true story, which I had seen, the patient I had seen in Sir's clinic. So there was a lady, completely blind, completely blind. She had a certificate of blindness, and she was appearing for UPSC exams. So they have separate quota. Who are specially able, they have separate quota. They have separate thing to write and all those things. So she was under treatment. Like since birth, she had very like the vision was very less for her. And as she grew up, she got completely blind. Then Suddenly someone told that here you can be cured anta. So she visited Sir's clinic. So treatment started as usual. Treatment started, but without fail, she continued that treatment for around 5 years. 5 years. Weekly thrice, Sir used to call her. Weekly thrice for the Viddha Karma sittings. Along with in this 5 year, she cleared UPSC exam. She became collector, and still she was continuing this treatment. One fine day, after like around five years, her vision came back. Her vision came back. She was able to see. Only thing is, number one, doctor should have patience. Number two, patient should have patience. And that comes when you explain them, you show them the cases, you show them the videos. So that's when they get they agree to your treatments and all. Yes. So such many cases were there. I will be sharing when we start with the presentation. Okay. So again, if any newcomers want to share why you are curious to know about this. Newcomers, I'm telling. Any two, three, quick, because we have to cover a lot. Any newcomers? Why you are here? Yes.
I'm from government college and we have seen in our OPDs in case OPD and all.
Yes.
So when they did Viddha Karma, the patient felt instant relief.
Hmm.
So it feels like a wow procedure, but we don't know the points, we don't know the procedure.
Hmm.
So that's why we are curious to know.
So it gives an instant relief. Yes. Next. Anyone else? This is the common question I ask in every seminar or workshop which I do. Anyone else? Quick, 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 quick. Yes. Huh. Okay.
I've taken a synopsis of Viddha Karma in Kannada.
Yes. Okay.
Now I already started a pilot study. I don't know the actual points, like how we should insert till which depth for how many seconds, like how many minutes and all.
Okay.
But in the pilot study, I've got some of the results.
Yes.
Like,
In how many settings?
in 5 settings.
Okay. Karna nada.
Yes, sir.
Okay.
Alternate days, sir. From first day, third day, fifth day, and seventh day.
Internal medications are given?
Along with this, I'm giving Nasa Karma, sir.
Okay.
Balatala Nasya.
Okay.
Internal, I'm giving Sari Bagi Bagi.
Okay. Okay.
One tag.
Okay. So in such a less span, we are getting results. Okay. Have you tried any other treatments for them? Like apart from Viddha Karma, any other treatments? Only those treatments except Viddha Karma?
Nothing, sir.
Nothing. Okay. So for that curiosity, you have come here. Next. One more I will take. Anyone? Then we'll go. We'll do some theory work, boring work. One more.
So, to know the probable mode of action.
Okay.
Because we know our friends are doing at the OPDs.
Yes.
But many questions arises in mind. So how it actually works? Is it really a temporary thing, or in which avastha we can do?
Okay.
For the clarification.
Okay. Okay. Fine. So there are doubts regarding Viddha Karma, how it works, how actually it a temporary relief or is it permanent relief? Does it cure roga or is it just a symptomatic treatment? Yes. Okay. So we'll start. Next. Okay. Blur is blur content. So you know these two great Vaidyas, everyone might be knowing by now. Yes, Dr. R.B. Gupte, Ramachandra Gupte sir. He is my sir's guru, Dr. Chandrakumar sir's guru, and my guru, Dr. Chandrakumar sir. So, R.B. Gupte sir was Shalya PG, surgeon. I'll just give brief introduction. Sorry for who are attending for the second time. So he was like, show me the proof, I will accept. He used to tell, Baap dikhao, nahi to shraddha karo. You show me your father or else do all his kriya karmas. So like that pinpointed he was there. So in his UG, after we complete our BAMS, like after fourth year, we have some time, right? Till the result comes. So he had gone to his native in Konkan, Savantwadi. So there he had conducted an experiment of suturing with ants. So he caught 10 big frogs. He dissected them, dissected the intestines. He sutured it with the black ants and sent them, tied a rope to their legs and released them into the pond. So after around 15 to 20 days, he took them back again. So out of those 10, 7 were all right. And out of those 3, 2 were having some infection and 1 was no more. So this was the highest success rate. So this is how he used to learn Ayurveda. It's not like we learn in college and we just leave it. So bringing it into practice is much needed. Yes. And one more thing is like he has a huge knowledge about Dravya Guna. Anything you tell, he will tell. So he had conducted one study on Kadamba Niryasa, Kadambatok Niryasa, where it tells that it stops the hereditary disorders, like it stops it going to the next generation. So he had selected 10 couples who are hemophilia positive. So it is a X-linked disorder. So both the couples he had taken, like father was also positive, mother was also positive. Obviously the progeny will be positive. So in that 10 couples he had given Basti with Kadamba Niryasa. All the 10 couples progeny were negative. So that, and to that era, we have now mobile, WhatsApp, email, everything we have. But that time, no, he had written the post to those patients. How did he collect the data? He used to visit hospitals in all over the India. He collected the data. He took their address. He took their number. He contacted them, and then he did the research. So how dedicated towards Ayurveda he was, you can imagine. And his Shishya, Dr. Chandrakumar sir, he is also one kind of हिंदी में बोलते हैं ना कीड़ा रहता है, हर चीज में घुसने का कीड़ा है. He was like that. He used to question each and everything. Sir, why this, why that, why this, why not this, like that. So one incident I would like to tell. In Visuchika, they told Parsnidha. So sir had asked, sir, why, how come? So that time Gokte sir told, remember me when we do appendicectomy surgery. So one day they were posted to appendicectomy surgery, and he asked sir, you had told me to remember. So sir told, okay, now there is a bleeding in abdomen, now just put the cautery to the parsnip. Immediately the intestine squeezed. How we squeeze our clothes, no? Like that, intestines got squeezed over there. So, whatever is written in our Ayurveda, it's not illogical. There is a logic behind that. The only thing is we don't know how to see through Ayurveda. We study even now Ayurveda through the perspective of modern, and that's what I feel it is very bad. We should see through Ayurveda only first, then later comes modern. Yes. So after this session, I want one thing from all of you: see any disease through the perspective of Ayurveda first. Later you go. Later you go for hypertension, diabetes. You go later. First, see through the perspective of Ayurveda. Which dosha, which dhatu, what dosha, dosha samvartana, where, sthana, samshraya, all those things. Yes? So next. Again, why Viddha karma, why Agni karma? Same slides. Siraveda is called as Ardha Chikitsa. So Viddha karma is nothing but based on Siraveda principles only. So if you have studied Sushruta Sharira 8th chapter, Siraveda Vidhi Sharira. So there is one big shloka. I'll be dealing with that again. So there they have told many places to do Vyadhana karma, but there are some places where we don't find siras. So what to do at that time? So there is one more shloka in that particular chapter stating that if you don't know, if you don't see any siras, apart from that marma in that area, you do Siravedana. And how deep you should go based on which part you are doing, that is also told there. So we'll be doing that, dealing with that also. Next, it takes minimal time. You just prick, remove the needle. No need to wait also. Small space, no need of any huge instruments or anything. Small space, large setup is not needed. Immediate results. I know many of you are practicing after my lecture last month, and they are contacting me also. Like, sir, results bartide. It's good. So when patient sees results, he will always come to you only. They need, first thing is they need to their pain to reduce, whatever pain they have. Not only the pain we feel, or whatever pain, even though it is a manasika, whatever pain. So that needs to be come down. First and foremost thing. Later you go for investigations and all those things. So that is necessary, and this gives you that. Then it is cost effective. 100 needles you will get for around 70-80 rupees if you take it in wholesale rate. 100 needles. So 100 Viddha karma, 100 patients. That cost effective it is. Yes? Next. So where are the references of Viddha karma? So these are the references. You can note it down. These are the roots of Viddha karma and Agni karma. Branches are all over samhitas. Especially what we are doing today. In Shalakya, they have told everywhere, wherever the chapter is being dealt. Okay? Next. So again, Nirukti, Vidha means Vyadha or Chidritaha. To do Chidra or to puncture is Vidha. Agni karma, in Dalana they are telling Agnina Krutva Yat karma is Agni karma. What we do by using Agni, any karma is called as Agni karma. Next. Yes, these are the main basic things which you should know before doing Viddha karma, Agni karma. First, Marma Jnanam. Second, Sharira Rachana Jnanam. And third, modern anatomy. You might tell why modern anatomy separate, Sharira Rachana separate. There is the relevance. First, importance of Marma. What is this? Bhishma Pitamaha. Bhishma Pitamaha lying on? Yes. So it is told that the arrows were thrown towards him, knowing the jnana of marmas. That's why he lived for so many days. though he had ichha marana, yes, but for that also this jnana should be there. Mara intiti marmani, whoever it is. That's why Lord Krishna also died, because of he got what agata on Kshipra marma. Yes, next. Exactly this. So location of important marma. Why Kshipra marma is so important? Because it is used widely in the practice of Viddha karma. Even in Shalakya Rogas also, it is used widely. Based on the samprapti, what patient is coming with. You have to identify that and then use accordingly the points. So here again, I would like to tell, Krishna had got injured at his Kshipra Marma and he left this world by having Akshepata. They have told like Tatra Viddhasya Akshepanena Maranam Cha. Yes, very Kshipra Marma. Angushta Angulayor Madhye. So when anyone asks, you should tell this shloka, not like this. Because this can be wrong. But when you tell the shloka, you will be correct. Yes. So not this, very Shankar, this. No. There is Vru Madhya, this. No. Yes, because today what we are touching the topic is very confusing. Very confusing, I'm telling you. Yes, even today, sometimes I also get confused. So imagine. Next. Other important marmas, Shanka marma, Stapani or Bhru Madhya, Vidura marma, Apanga marma, Nabi marma, all those things. This I have taken related to Shalakya itself only, not all the other marmas. Next. Yes, importance of Sharira Rachna is, this is the best example which we can give. So first shloka, I guess everyone have by in their first year UG. Ashtanga Hridaya. Yes, Visuchika Chikitsa Sutra. There they are telling Parshni Daha. So there is a pain. Visuchika is Suchi Diriva Gatrani Vidyatiti. First line? Yes. So there they have told Parshnir Daha Prashasyate. So do Daha, Agni Karma on the Parshni. Why there? So there comes the importance of Sharira Rachana. So where we do Agni Karma, there is a huge, Hasti Dhatu is predominant in that area. Usually on heel, we see Asti Dhatu as a predominant, which further acts on Astidhara Kala, which is holded by the Astidhara Kala. And in Tika, they are telling that Astidhara Kala is also called as Purishadhara Kala. So this Visuchika usually goes under Pakvashaya and Purishadhara Kala is mainly involved. Hence it works. If you take any nerve endings or something like that, you will not able to find. You will be not able to find that. What is the reason behind that? That's why Sharira Rachana is important, and reading Sharira Sthana as it is without taking modern into Ayurveda is must, is a need of an hour. That time only many of the concepts, you not only Viddha and Agni, many of the other concepts which are told in Samhitas will be cleared. Yes? Next. Modern anatomy, here basically for surface markings we need modern anatomy. In certain shlokas, like last time I had told, Amsay or Antare for upper bahuka or frozen shoulder, they have told in and around Amsa Pradesha. So where exactly? Why? Why there only? Amsay or Antare means huge playground is there to do with the karma. But why? Where exactly do? Which muscle is involved? So all this will be coming by surface markings. Surface markings in anatomy, what we had learned in first year BAMS. So that we have to not forget. Next. Everything is only first year in this. Only thing we should apply. But what we do, first year, oh, I thought, second year, next, first year gone. Again, this is a nerve supply of cranial nerves to various organs. Sometimes what happens is, especially like what cases I've seen in is on this infertility cases where there is no ovulation, anovulatory cycles are seen. So sir used to do Dhupana Agni Karma on those particular nerve endings. Very next day the ovulation would happen. So where which nerve supplies which organ also you should know. So that is also important. Next. ಬ್ಲರ್ ಯಾಕೆ ಇದೆ ಮುಂದೆ ತಗೋಬೋದಾ ಅಷ್ಟೇ ಇಲ್ಲ ಲಾಸ್ಟ್ ಟೈಮ್ ಕ್ಲಿಯರ್ ಇತ್ತು ಅದಕ್ಕೆ ಇದು ಝೂಮ್ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ ಅಷ್ಟೇನಾ ಓಕೆ ಸರ್ ಪರವಾಗಿಲ್ಲ ಸೊ ಡೂಸ್ ಆ್ಯಂಡ್ ಡೋಂಟ್ಸ್ ಬಿಫೋರ್ ಡೂಯಿಂಗ್ ಎನಿಥಿಂಗ್ ವಿ ಶುಡ್ ನೋ where we should not do that particular procedure. So do's and don'ts are in that. First and foremost is don't try if you don't know. So if you don't know, don't try. There are n number of photos on social media where they are pricking here like an eyebrow. In Grudrasi, whole leg they are pricking. No, that is not a Viddha karma. There you may further harm patient. May I am telling. And once the damage is done, it is very difficult to take patient back from that particular damage. So that's why if you don't know, don't do. Or else if you want to do that much of eagerness you have, you ask someone who knows it, take their guidance and then do. If possible, Chandra Kumar sir. Then see, the next three are contraindicated for Rakta Mokshana. But the beauty of Viddha Karma is that we can do in these cases also. Like 2 old patients, pregnant ladies, infants, and Varshabri Nishagama, it is told Rakta Mokshana is contraindicated in that. So we can do Viddha Karma as we are not taking huge amount of Rakta from the patient's body. And don't use it in the place of marma. So except marma, you can do prick on the patient's body. Except marma, don't touch marma because marayanti iti marmani. It can cause any damage. So Vaikalyakara, Rujakara, any damage out of those it can cause, even marana also. Next. So apart from Ayurveda, we see in other sciences like Chinese medicines, acupuncture and moxibustion therapy, where again acupuncture is similar to that of Viddha Karma, where the needle is not hollow in acupuncture, but we use hollow needles as we are expecting doshas to come out from them. Yes, and moxibustion is they use a particular drug or particular dravya and keep on that particular area and they just lit that dravya, and because of that Agni Karma effect is seen. So in different diseases they use different dravyas based on their own science. I don't know that much of that, but similar to that of Agni Karma it is seen. Next. Viddha Karma, yes, as we all know, it is well versed for pain management, but yes, it cures roga. Only thing is that we should know how to do it. Yes, it is there for curing roga also. Next. needle number 26.5 and needle number 24. Cotton and spirit. This is all the thing you need in your clinic to do Viddha karma. So needle number 26.5. Why? Because next. Because it is exactly that of one vrihi praman. And in our shastra they have told to prick ardha vrihi, one vrihi, two vrihi, like that. So hence one vrihi pramana is that 26 and half needle. Exactly. It comes around 11 to 13 mm long. Yes, one vrihi is approximately 11 to 13 mm long, which is exactly that of 26.5 needle. And this is the shloka where I have told, like if there is no sira visible, so how much depth we have to go in that particular part, how much we have to prick the needle inside. So that is the shloka told in Shushruta Sharira 8 bar 9. You can refer, you can read through it, you can read the commentary also. Next. What is expected? Avyakta, Asrak, Sravati. They have tell you. So, Alpa Vyakta or Avyakta. Rakta can come or may not come from that particular site where you are pricking. So, that is expected. And in Ashtanga Hridaya, they have told Yathoktanam Adarshane. Yathoktanam Adarshane, andre whenever the siras are not visible, you should do Vedana in Marmahina Yatha Sanye Deshe. So Marmahina, leaving the marmas, and Yatha Asana, wherever they have told, near to that. If you are getting siras near to that, do Siraveda from that site. Or else do Viddha karma, based on the previous shloka, how much to insert the needle, how much not to insert the needle. Usually we insert half vrihi only, but based on patient's build. See, when you do Bhrumadhya, whenever the fat person comes, exactly half he goes into Bhrumadhya. But when the lean person goes, not even 1/4 needle goes inside. So what to do that time? So it depends on person to person. Purusham Viksha. It depends. But the common formula is Ardhavrihi. Most of the time, Ardhavrihi will go. So if you are doing into the baby who is who is of 1 month, 2 months, will that needle go half free inside? No. So based on the baby's what you say built up, samhanana of baby or the built of the baby, you should prick that much into the skin. That's all. Next. Agni Karma, again it is for both Vedana and Roga Shanti also. Basically, what we see in our colleges is only for Vedana Shanti. Only for whenever there is pain, we do Agni Karma, that too red hot shalakas. Nowadays, we are evolving, taking Swarna Shalaka and all. But it is for both Vedana Shanti as well as Roga Shanti. Next. Types of Agni Karma based on extent, Tvagdagda, Mamsadagda. Till what deep we have to go. Based on that, there are two types, Tvagdagda, Mamsadagda. Based on Dravya, Snigdha, Ruksha. And they have told, Tatra Snigdham Ruksham Va Ashritya Dravyam Agnir Dahati. So what Dravya you are using, that is important. I will, like, most of the time I will take the case of Apavahuka. They have told to do Guda Agni Karma there. I have personally tried with Swarnachalaka Agni Karma. Though Swarna is best metal, it didn't work. There is no value for Swarna in Apavahuka. So there, whatever you use in your kitchen, Guda is a hero over there. So what dravya in which condition you are using matters. Like in Kamala, we do Haridra Kanda Agni Karma in snuff box. There we are expecting to create one vrana, one wound over there, and from there Srava is going. So as the Srava goes out of that wound, the bilirubin count comes to the normal. Within say around 2 to 3 days, the bilirubin count comes to the normal. So, what is the purpose of that particular Agni Karma? You should know, and you should use that particular dravya. Only then it will work, or else it is not going to work. You will get results, but again it will reoccur. That is the one main thing in Agni Karma, because dravyam agnir dahati, they are telling. So whatever dravya you use, similar results you will get in the patients. Next. So these are some instruments. I will quickly revise. Swarna Shalaka, Mrittika Shalaka. Swarna Shalaka in all the pains, muscle pains, where we do Bindu Agni Karma with that. Mrittika Shalaka for calcaneum spur. Why Mrittika Shalaka, you know? Because the skin over the heel is very thick and you need more amount of heat to reach over there. So Mrittika, you have seen, it holds good amount of heat in it. So Mrittika Shalaka is used. In that we mix Haya Mala, horse dung, and Loha Bhasma or Mandura Bhasma, and we make it. Or else simply Mrittika Shalaka will also work. So what if we don't have a Mrittika Shalaka and patient comes? You can use Ishtika. Ishtika, somewhere it will be there on the road. Bring that, clean it, do Ishtika. So last visit to my Maharashtra, I had got one patient who is having frozen shoulder. So that clinic is in my home only. So I went into kitchen and I asked, Amma, Guda elli anta. Amma idu illa Guda khali agide. So one more yukti I had used is, I had made Shatavari Kalpa, which was gone wrong, and it was into some chocolate like consistency. So it was consistency of that good only. So I used that. I took fork. I took that Shatavari Kalpa on that. I heated and I did Agni Karma on that. Immediately results you have. So if not Goda, you use some other similar dravya. You can use eclairs chocolate also. So thing is that similar dravya should be used. If not that, don't change that dravya completely. So next is Loha Shalaka to remove corn, warts, everything. Next. Cosmetic Agni Karma is now famous, where we remove moles or any type of skin related issues. We use small shalaka, and it is made up of tamra. Tamra is because it is swachha. Next. Okay, apart from this, we use Haridra Khanda to do Kamala Agni Karma. Then we use Rekha Agni Karma for Apachi. We use Swarna Shalaka only, and we do Rekha Agni Karma over the wrist joint. That is not the topic, but I am telling various other types of Agni Karma. We use Bhallataka. Bhallataka Taila we use for nasal polyps, even tonsils. Bhallataka Taila we use. So that is also type of Agni Karma. Next. Rules of Agni Karma. So there is no specific rules as that of Viddha Karma. Viddha Karma has specific points, but Agni Karma doesn't have that. They have told Atyugri Ruji Vayuhu. So wherever there is a more pain, more amount of tenderness is seen, in that place you can do Agni Karma. And Uchrita Kathina Supta Mamsa. So wherever there is a Uchrita Kathina Supta Mamsa, you can cut it using Agni Karma. Yes? Cut. You should not do Chedana, you should do Agni Karma and do Chedana. Especially cancerous tumors. There is one Vaidya, Dr. Prashant Tiwari. You might have seen his videos on Instagram. He does that without local anesthesia, without anything. He uses normal ice to give local anesthesia. If you press the eyes on that particular side, you will have around 10 to 15 seconds to do Chedana using Agni Karma, and that is enough. Again, if the patient is telling it is paining, again put the eyes, do Chedana. If the tumor is more, if the Chedana area is more, so without anesthesia. Next. So, previous. So these are all the rogas where we should use Agni Karma, as told in Sushruta Samhita. Next. So shall we jump into? So I will be now only focusing on Urdhva Jatrugata rogas. Any other rogas you want to have you are having any doubts, we will deal. If time permits, we will deal it in last session. We are keeping question and answer session in the last, so that time we can deal. But first, preferably this Urdhva Jatrugata rogas. So what are Urdhva Jatrugata rogas? What are Urdhva Jatrugata rogas? Jatru, shoulder. Above that, any rogas are Urdhva Jatrugata. So is it only ENT or eye? Yes? Or any other rogas apart from ENT and eye also will come in this? Huh? Yes, shoulder also will come. Goiter, thyroid will come. Not thyroid exactly, the apache we can take, or manya granthi, or those things you can take. Griva, yes. So we'll start with Jihva Roga. I have directly put Gopte sir's video where he does Viddha, so that you will know he is accurate. I will not show. Yes, because there might be confusion again. So what he does, you just see carefully. Later, if at all you are not getting it, we will clear it in the doubt session. Yes, next. Just press once. ಇಲ್ಲ ಬರುತ್ತೆ ಇಲ್ಲಿ ಹಾಂ ಸಿ ದಿಸ್ ಇಸ್ ಜಿಹ್ವಾ ರೋಗ or mukhapaka. So there is frenulum under the tongue, yes, and there is a artery besides your frenulum on the both the sides, yes. So there, in between that, we have to do Viddha Karma on the both the sides. So they have told Jihva rogeshu adho jihvayam dante danta vyadhishu cha. So in danta vyadhi they have generalized, so you can do it in any danta vyadhi. Jihva roga, all the types of Jihva roga. How many types of Jihva roga? 5 or 4? 5. Okay, so all the types of Jihva roga you can do. But how should be the position of Jihva is in the second shloka. What is that? Unnamita vidashta jihvagrasya adho jihvayam. Unnamita vidashta jihva. The jihva should touch unnamana. Unnamana is above. So ask patient to do jihva to touch their hard palate, and then do Viddha Karma. Don't ask patient to remove the jihva out and then do. Hard palate it should touch, and then you should do. That time you will get that particular spot to do Viddha Karma. You want to see the video again? Yes. Just see, this is frenulum. Just beside that, he is doing Viddha karma. You can use syringe or you can use any forceps and do Viddha karma there. He has kept it for so long to just demonstrate. You can just prick and remove the needle. No need to keep it for so long. Okay. So regarding this, I would like to share that case here only. So I had one case where there was a swelling of salivary gland. So almost it was around 7 centimeters on the right side. It was paining and patient was like full srava bartide. Srava in mouth. It was there. So what I did is gave Kafahara Aushadhi. Kandu was there. Srava excessive was there. Kafahara Aushadhi internally I did. Along with that, I did this Viddha. But before intake of Viddha only, Aushadhi only, I did this Viddha. And immediately after that Viddha, she told, sir, that Srava is gone. One sitting only. One sitting, she told, sir, that Srava was coming, no, it is not there now. Patient was in front of me only. She didn't go out also. She didn't do any other work also. And she told her, sir, Srava is gone. Then after 3 sittings, 3 days, I had called her regularly for 2 weeks. The 7 centimeter swelling came to 3 centimeters. Along with Aushadhis, of course. And along with that, I had told her to do Kavala with Gandusha with Tambula Patra. I just told to chew Tambula, keep that Swarasa for some time in the mouth and then spit it out. Tambula is Kashaya Rasa, Kafaharagi. So, with all that, 3 days were sufficient to bring down that swelling from 7 centimeter to 3 centimeters. Later on, I guess 1 more week and it was all right. Next. Wait. So, Nasa Roge. Gandha Agrane Nasa Rogeshu cha Nasa Agre. Tip of the nose. This was there in that big shloka which we did last time. So see the way he is pricking. He is pinching the nose and then pricking. Pinching the tip of the nose and then pricking. Not simply pricking. Yes? So, Gandha Agrane and all types of Nasa Roga, they are telling. Nasa Rogeshu. So, any type, polyp, Nasanaha, Gandha Agrahana, COVID. So, all those things, whatever related to that Nasa, you can do this. Along with this, we can take Upanasika. Upanasika is, you laugh, there will be one crease over on the cheek. So, where that crease start exactly? So, that is Upanasika point. So, you can take that also. Upanasika is a point where we use it for Nasa Roga, Akshi Roga and sometimes Karna Roga also. So that is a junction of all these 3 indriyas, Upanasika. Next. Hanu Viddha. Hanu Viddha we will see first now.
Previous video also.
Okay, take previous. Once you press, that will automatically. Okay. See, pinch the tip of the nose and then prick. Pinch and then prick. This is also important. Because there is one danger spot in the nose. What is that? Little's area. So if we don't pinch, there are chances that we go in that danger spot. There are chances. I'm not telling you will go. There are chances that you will go in that particular spot. Understood? Next. Yeah. Play the video. So this is Hanu Viddha. So I'll just demonstrate. You have Adam's apple. In boys, it will be prominent. Yes, just above the Adam's apple is Hanu Viddha. This point is taken from acupuncture. This is not mentioned in what you say. See exactly this point. This is Adam's apple. This is point. So this is taken from acupuncture science, where they use it for gala rogas. Sometimes we have to use it for jihvagata rogas also, tonsillitis, jihvagata rogas, where patient is not able to speak also. If you can take ado jihva, it's best. But what to do when kids come to you? Kids will not do their jihva up and they will make you break, right? So that time this point comes into action. This also can be taken as adho jihva only. This point exactly is used for this also, what you say, goiter. In thyroid cases, this point is also taken. But you should see how the samprapti of thyroid is. Whether there is a swelling, take this point. Swelling of thyroid gland. So take this point directly. Yes, it will not reduce the counts of thyroid, whatever you see in the report. It will not do that. It will reduce the thyroid gland swelling. Yes? Next. Karna Roga.
Everything you're doing after.
Yes. See, wherever I don't mention it is Ardhavri only, it is to be understood, okay? So, Karna Vyadha, there are 2 points. According to Shushruta, according to Ashtanga Hridaya. Shushruta tells, Karnayor upari samantat, Karna shule tadrogeshu cha. Karnayor upari samantat. Karnayor upari. Just behind the Karna. But it is above. Samantat. Samantat, here we can take the Keshanta Sandhi. Just behind the where your Karna starts, right? See this is starting of the Karna. Just behind that, where there is a Keshanta Sandhi, this is the first point. Next point is Vidura Marma Ashrita Adho Bhagasya Vyadhet. Vidura Marma. Now you should know where is Vidura Marma to do this. Viddha Agni. Where is Vidura Marma? Huh? Yes, mastoid process we can take. Yes? Everyone knows mastoid process where it is? Yes. So just Ardha Angula below the mastoid process, we do this with the karma. So you can play the video. Cursor ಇಲ್ಲಿ ತಗೊಂಡು ಕರ್ಸರ್ ಇಲ್ಲಿ ತಗೊಂಡು So just see. This is Karna Urupari Samantat Karna Shule Tadrogeshu cha. Just behind and above. And another one is Vidura Marma Ashrita Adho Bhagasya Vyadhet. So this is Vidura Marma Adho Bhaga, half anguli below the Vidura Marma. Was it visible here? Okay. So this is Karna Roga. Karna Roga. So any type of karna roga it might be. So again here we are seeing these points, right? We can do Agni karma on the same points based on how the vyadhi is, whether it is origin of Shita origin or whether it is the origin from Ushna origin. Ushna, there is Vividha Virya, you know, right? Two Viryas in Ayurveda, Shita or Ushna. So if there is the Vyadhi is caused due to the Shita guna, do Agni karma. If it is due to Ushna guna, do Viddha karma. Same. So sometimes what happens is, I had one case where the hearing loss was due to working excessive in sun. Huh. Okay. It one explain matter. So that case was very like he had a heat stroke and he had loss of hearing loss. So that is due to the Ushna guna. One more case was there of a child. I get explained last time also. Night 11 o'clock I had got call, and he like the mother was like, my child is having earache. So night 11 o'clock I told, who will go there? And so I told them, just put Snehana and see. But after putting Snehana it increased. Shita guna. Same occurs in Amavata. If you do Abhyanga in Amavata, it will increase, pain will increase. Then I went, did only Agni Karma on these 2 points. Within 15 minutes, child slept. Pain was gone immediately after doing Agni Karma only, and child got sleep also. It was due to basically the cold, rhinitis, Pratishtha, where there was a block due to Shita Guna only, and I did Agni Karma. On the previous case, it was Viddha Karma. So there matters how you see the disease. It's not only the hearing loss or doing what is that test, audiometry. It's not only about that. You should see how that disease is coming to the patient. Yes? Okay. So we'll take 5 minutes break. There is another projector screen coming. So after that we'll continue. Okay.
And tea is ready. You can have tea and come back. And meanwhile, we will arrange alternative projector so that it can be seen clearly.
Boring?